Good evening. It's a health emergency that has already killed 41 people in China, and tonight there's confirmation the coronavirus has reached Australia. As we go to air, there is one confirmed case in Melbourne, while in New South Wales there are 2 probable cases in Sydney, with another 5 people being tested. The virus might have also spread to Queensland. 2 people there are being tested, and another 4 cases in South Australia are yet to be confirmed. Authorities warn it's highly likely there'll be more cases, but say Australia is well prepared to deal with an outbreak.
Building a 1,000-bed hospital in Wuhan in just under a week to deal with China's coronavirus crisis. A health emergency that's now made its way to Australia, with our first confirmed case and almost certainly 2 more.
He was confirmed as positive after a series of tests earlier this morning.
The 50-year-old Chinese man flew into Australia last Sunday from Wuhan via Guangzhou on China Southern Airlines flight number CZ321, landing at 9:25 a.m. at Tullamarine Airport in Melbourne. The plane he arrived on, an A380, carries more than 500 people.
They will all be contacted and will be making arrangements to start making those calls from today.
Not knowing he was infected for 6 days, he spent his entire time in Melbourne at his family's home.
And are being closely monitored for any signs of illness.
2 men in New South Wales, one in his 30s and the other in his 50s, are in isolation in hospital with all the surefire signs of coronavirus.
And in one case, they had contact with a confirmed case of the disease in Wuhan.
They've been in contact with dozens of people since, and authorities just don't know how widespread this could become.
The Australian Government, of course, has been taking this issue incredibly seriously. We have activated all the necessary precautions and procedures.
A child taken to hospital in Sydney with signs of the virus, doctors and nurses in full protection gear, but he was cleared.
I wouldn't be surprised if we had further confirmed cases.
Coronavirus is a flu-like disease that can cause severe pneumonia. Symptoms can take up to 14 days to develop. There's no vaccine and antibiotics don't work either. When it comes to treatment, all doctors can do is make the patient feel comfortable and let their immune system try and fight it off. Most of the fatalities in China have been older people with existing medical problems. 20 million people are now in lockdown, overcrowded hospitals with doctors in hazmat suits.
Do not travel to Hubei province at all.
In China, the virus has killed at least 41 people, with more than 1,000 confirmed cases and another 8,400 people under observation. And it's spreading to new continents, with confirmed cases in France, the US, South Korea, Japan, Thailand, Singapore, Vietnam, Taiwan and Nepal.
There may be some people who have been in Wuhan who got out before the travel ban was instituted by China.
Including on Thursday, the final flight direct from the epicentre of the disease came into Sydney from Wuhan. Face masks and some warning flyers, but really no idea who has it and who they could spread it to.
The risk really is in people who've come from that part of China. There is, at this stage, no risk to the general Australian community.
Chris O'Keefe, 9 News.